My name is Dr. Marcia Mickelburgh. I'm a specialist plastic surgeon in Cairns in Far North Queensland. Today I'll be speaking about breast reduction surgery. Breast reduction surgery is a very commonly performed procedure. It is ideally suited for women suffering from back, neck and shoulder pain. Women also commonly report suffering with rashes under their breasts, grooving in their shoulders, and difficulty fitting into clothing, including swimwear, bras, shirts that they need to button up for work. The procedure is performed under a general anaesthetic. It takes between 2 and 3 hours, and I often admit these patients overnight because my patient population tends to travel long distances for surgery. There is no specific age range, but patients who are seeking breast reduction surgery tend to fall into 3 groups. There's a post-adolescent group who have gone through puberty and are suffering with macromastia. There's a postpartum group suffering with macromastia, and there's a postmenopausal group who have usually tolerated large breasts for the majority of their life, and that postmenopausal breast growth has resulted in so much discomfort that they're now seeking surgery. Ideally, our patients are in a healthy weight range. They suffer no significant medical history. We will always make sure a patient has a normal mammogram before surgery and take a thorough history with respect to medications, blood thinners, allergies. Breast reduction surgery takes between 2 and 3 hours, and we perform it under a general anaesthetic. The preoperative markings are done before the surgery begins, and that can take a certain amount of time to ensure that the nipple position and the amount of volume to be removed is accurately marked out. The procedure is an operation designed to maintain blood supply to the nipple areola complex. The breast is reshaped to both reduce the volume, center the nipple on the breast mound, and address any skin laxity or skin excess. In the majority of patients, we can avoid drains. The sutures are dissolvable and the dressings are often waterproof. And most women will wake up with a post-operative compression bra on, which they'll wear for 6 weeks afterwards. Patients will then either go home the same day or be discharged the next day, usually with antibiotics and appropriate analgesia. The post-operative recovery is relatively straightforward. In my patients, I ask them not to drive for 2 weeks, to not do anything strenuous for 6 weeks, and I like to have a preoperative discussion around what that means for them in terms of their current lifestyle, in terms of duties around the house, like cooking and cleaning and laundry, whether they've got a desk job or an active job, and if they have an active job, how that might be modified, or whether they're taking that time off from work. If they have children, who's going to be taking care of those children, running them to school, etc. I do emphasise that this is an opportunity for patients to rest and recover, and that they need to really allow that process to happen to ensure that they're reducing their risk of post-operative complications and allowing their bodies to heal. I like to see my patients at a week post-op, ensure that they're not experiencing any complications. I also like to see them the following week to change their dressings, and then at 6 weeks. And at that 6-week appointment, that's when I'll often allow my patients to wear a different bra, get back to the gym, get back to their normal activities. In terms of breast cancer screening, I usually also ensure that their mammogram is up to date preoperatively, because in most cases they won't be able to have a mammogram for 12 months postoperatively. And at that 1-year post-op visit, I always ensure that they've got that follow-up for their next mammogram to ensure that screening isn't delayed by their surgery. The main aim of this surgery is to improve a patient's comfort and to ensure the most robust result moving forward in that patient's life.